Hi, I'm Holly Helbig. I am part of the Equine Technical Service team with Zoetis, and we are here today to talk about serum amyloid A in horses. Serum amyloid A is an acute phase protein that is released from the horse's liver in response to inflammation. SAA, we always try to say that it's another tool in your toolbox. So it's great to be used alongside your stethoscope, thermometer. It can also be used in conjunction with your CBC chem and fibrinogen. SAA is valuable because it's so sensitive and very specific, and it elevates very quickly, faster than other biomarkers. Oftentimes it will elevate or rise prior to a change in white blood cell count. Compared to a fibrinogen, it will elevate a lot quicker. So it's extremely valuable because of the sensitivity and specificity around it. And on the backside, it also will decrease very quickly. So it doesn't linger around for days and days. It actually will start to decrease about 50% every 24 hours once that infection starts to become resolved. Biosecurity is really important, especially with the recent EHV1 outbreak that everyone is very aware of. So SAA is really unique because it's so specific and sensitive. It actually, in some of our case studies, has shown that SAA can be elevated prior to clinical signs, including fever. So horses that have been exposed to other horses that are already ill, SAA can be something that can be used to help decide how and when to quarantine. It's a great way to screen horses that are potentially going to competitions, horses that have just arrived off a trailer, they've shipped a long distance. That's another great use of it. And then on the back side of an outbreak, we use SAA often to decide when to run a PCR and determine when they get out of quarantine. So there's a lot of information out there and a lot of different ways to use SAA.